So much, Chrissy. Well, we all want to know about dentistry and health, and joining us, as always, with some important information is Dr. Paul Coleman. Thank you so much for coming in.
You bet.
So today we're talking about minimally invasive dentistry, which is actually the new way of doing fillings and bonding, correct? Now, it's interesting. I don't want to disclose, but I just got cavities filled this weekend because what happened was my old amalgam filling, which was silver back in the old when I was a child, actually had chipped off a little bit. And so I got a cavity underneath it, and my doctor had to fill it.
Sure.
And I was actually happy because now it's a tooth-colored one instead of a silver-colored one.
Right.
Talk about this procedure and what it really means.
Well, in the advent of being able to bond a tooth-colored filling material to the tooth, started in the early 70s and has kind of evolved so we can do a better and better job of sticking the material to a tooth. We don't have to cut away excess amounts of tooth structure anymore to make the solution work. The old silver fillings, we actually had to remove the decay and then go inside the tooth and create undercuts. So when we put the filling material in and it hardened up, the undercuts actually kept the filling in the tooth. Now we can just remove whatever's diseased or broken, and we need no undercuts, we need no physical retention because we can actually just stick the filling material to the tooth and actually strengthen the tooth in the process.
And it looks better, but how long does it last? A lot of the old school doctors like to use the silver amalgam fillings because they say it lasted longer, right?
It actually didn't last longer. It was very difficult to detect a problem around it because if you have a metal filling and you take an x-ray and you have the decay on the other side of the filling, you just can't detect it. So we were generally replacing the silver mercury fillings a lot later than they should have been replaced. A lot of people like to do them, in all honesty, because they're easy to do. You don't need, it's not a very technique-sensitive material, but when you're doing the bonding process, you have to be very precise in the way you do it to make it last. And with proper care, these things should last the same 15 to 25 years that you could get out of any filling in the past, and they look better.
Yeah, 15 to 20 years. Now, do people recommend, I know that some people who have a lot of silver fillings have some of the new tooth-colored fillings. What's the line of knowing when should you get them replaced? Do you just leave them alone unless there's a problem?
A lot of people just like to get them out because...
What's the line of knowing when should you get them replaced? Do you just leave them alone unless there's a problem?
A lot of people just like to get them out because there is mercury present and it does leach into the system, but I'm not going to go down that road here today.
Because some people would debate that there isn't and they're perfectly safe. Right.
That is a school of thought.
Yeah.
Now, the problem with the silver mercury fillings, aside from the mercury content, is that if you heat up and you cool off anything in nature, it expands and contracts. That material expands and contracts more than the tooth that surrounds it. So I seldom take a large silver mercury filling out and don't see cracks inside the tooth, many of which were produced by the material that was used in the first place.
I see. So there's a lot of technologies out there now that dentistry is changing and people have options, right?
Absolutely.
Yeah, and
more than ever before.
And some of the options in terms of things that they need to do, what are the best things to look out for if they feel like they have a problem?
Well, you should generally be getting your dentistry done before you realize it's a problem, okay? So regular checkups, having the dentist check the edges of the fillings. If they start to break down, go ahead and get them done. The sooner they get them done, the better. We've had a tendency, unfortunately, in dentistry from time to time to watch problems get bad enough to do.
Yeah.
And if things aren't perfect, all you're doing is allowing a bigger problem that's going to be needed to be addressed at some future date.
So definitely communicate with your dentist and make sure you get problems taken care of early. Okay.
The earlier the better.
Thank you so much. Always some useful information, Dr. Paul Coleman. Okay. Still ahead, we'll tell you about a recall of Thomas the Tank Engine toys. And has the tuberculosis scare made you think twice about who's sitting next to you on a plane? We'll tell you what germs experts say are lurking in the cabin. We'll be back.